Hi, my name is Mnoneleli Mdonga. I'm from born and bred in Gugulethu, Cape Town, the year 1974, August the 14th. I grew up in Gugulethu. I'm a cancer patient. When this thing started, it started in the year of 2020. I started to feel pains somewhere in my blood, in somewhere here. Just pains, just normal pains, but sometimes you can feel these pains. But I think that was somewhere in February. Then in March, there was a lockdown in South Africa. So there was no way to go to the clinic whatsoever, hospital. Somewhere in December 2020, I went to the Eastern Cape to bury my friend who was the comrade actually. So we went there. So when I came back to Cape Town, late Monday, I drank something to clean up my stomach. To say, no, my stomach, I must clean up my stomach because I have eaten a lot man on that side. What happened? My stomach started to work. On Tuesday morning, and my body was like, I was down, my body was down. And what happened now is that I didn't eat. So I started not to eat. The only thing that I can eat, if you can brought me amakheu or to the traditional amakheu. You see, we do have this traditional makheu. So that was the only thing that I was eating throughout December. But in January, that's where the problem started. The little bit a problem now. Because in January, I started to vomit. My stomach was cramped and everything, and I started to vomit, and it was at night. My sister is staying. He got his own bungalow at the back, but she came out because you can see by it says something's happening in the house. So she phoned the ambulance. So I was taken. That was January now, 2021. So I was taken to the Gugulethu Day Hospital, to the trauma side. I was checked there, but there was no X-ray. Just checked, and because they have to listen from you. What makes you to be here? What happened? So I told them. But at the time, as time goes, after coming back from the trauma, I can feel that there's a pain at my back. But I didn't take it serious. But to cut the matter short, February, again, vomiting, again, ambulance. I went to the trauma. But the doctor decided that I must go to the outside patient, OPD, so that I can go to the X-ray. I did go to the X-ray. The X-ray, there was nothing on it that they saw on the X-ray. This doctor, suspecting something from me as he was looking at me, he said, I'm suspecting your eyes, your lips. I'm suspecting something. I'm not saying you do have this thing. But the only thing that is happening is that this particular day hospital doesn't have resources. But I'm suspecting cancer, but I'm not saying you do have the cancer. But I'll write a letter for you to go to Mitchell's Plain Hospital, because they do have a CT scan, they do have a scope. He wrote this letter. I went to Mitchell's Plain. Mitchell's Plain gave me another date, somewhere in July. But on the week that I was supposed to go, the president called another lockdown. Monday, the 12th, they phoned me, because I was supposed to be there on the 14th. They phoned me on Monday that Mr. Mdonga, we are postponing this cancel of yours, but you will hear from us. And the pain at that time, I'm eating these tablets, different kinds of tablets. As I was waiting for them to call me, a Samaritan, I'll call it that way, he said to me, what can I help you? I said to him, can we go to a private doctor? And at that time I was doing damage here at home. I was doing damage. My stomach was working heavily. Now that is where my mother said, you better now wear a nappy, because it's hard for me to take 2-3 steps. I'm done, and the toilet is there. Then I went. This guy took me to this doctor, and I told the doctor, and the doctor checked me, and after checking me, she wrote this letter referring me to Mrs. Hospital. They gave me another date, which was on the 8th of September, for a scope. I went there, but the scope happened the following day because they saw something. Yes. So the following day, on the 9th, that is when they put the scope on me, on this side of my anus, and that is where they saw the results came out the same day. They say that my number 1 is blocked and my number 2 is blocked. So they are going to do an operation for number 2, as you can see here. You see? Yeah, so they put this thing on me. They say for number 1, they are going to take me to Groote Hospital, because the specialist for urology in Groote. And thirdly, you've got the cancer cell, Mr. Mdonga. But what was good for me was that I know from today what is inside of me, what makes me to be like this. That was the very important thing for me on that day, on the 9th, when the results came, 9 September. So I said, doing this operation, they discharged me on the 17th, and on the 21st is Monday. The following day, they gave me a date of the 21st that I must go to Groote. I think now I was there for both the urology and the cancer. There's a thing called, they call it a sting, next thing, something like that. But it's a pipe that runs between my kidney, my right kidney, and my bladder, so that my urine can move, because my urine wasn't coming out, so that it can move. So they put me that. While I was there, my mom was very sick. They took my mom to hospital. My mom too had the same problem of cancer. And while I was still there, doctors looking for my mom passed away for the same problem of cancer. I said she was too old, and the pains that I am currently having, in this bed here in Groote, and at her age, she cannot take them. I still remember in Groote they used to give me tramadols. Tramadols were not working for me. So I told the doctor that these tramadols are not working. They gave me morphine, 5 millimeter of a morphine, 4 times a day. I told them that even this 5 millimeter doesn't work. They say 7.5 was not working. They went to 10 millimeter, 5 times a day. I mean, yes. That's what I was telling you. From the morphine, morphine is the best. It's the best to minimize the pain or the problem that I want to raise here. It's a delay in the Gugulethu hospital. Not me having a proper inspection. They are just talking with mouth to do, just like a discussion, but they don't know exactly what is inside of you. There are doctors there, but there are no resources. I think that's one of the things that are to us poor communities like Gugulethu, Khayelitsha, Philip, and other areas. You see, Henya, Felt, Yonetra, you name them here. Is that these day hospitals, they don't have resources, and I think the government must put resources. That is my pledge. Other thing that I saw in Groote, while since now I'm usually in Groote, is that I'm very sorry to say this, but they're black people. I'm not a racist, but it's a fact that it's a lot of black people are there, and some of us black people, we don't know much about cancer. So that's another thing. And about the black people, particularly the male counterparts, if we feel the pain, You see, this pain, I said it came 2020, somewhere in January. And I said, up until, if at that time of January, I did went to the hospital or maybe to the private doctor, as although I didn't have the money, and I said, to go to the private hospital to say, can you take me to Grotesque, can you take me to such a place, Mrs. Place, so that I can be checked? Yeah, we understand that. I should have known, because what is very important is for us to check. You must check. Now, if you don't check, when this thing came, it came like it damages you. It damages you, because you can see from my side, it damages my bladder and all the, my number 2 and all that stuff. That is why I'm having this. Up until today, I'm still wearing a nappy. As you can see, still wearing a nappy, because there are many things that are happening. You see, when you are eating the medication, because in February I went to the radiotherapy medication, and it knocked me down. It knocked me down. There are things that are coming out at your back, in us. So you have to wear your nappy, because if you don't wear it, the trouser that you are wearing will be wet. That's another, and it's hard for a person who is poor, for us poor people, to have a cancer. But what is important is for me, I want to do this thing of awareness amongst my community, because I think what I am having currently is very painful as I'm sitting here now. So I think I need to do an awareness amongst my community. I think I must be the last person to have this thing, particularly on the male side, because we are the ones that are victims currently, because we don't want to go and check ourselves.